Hi, Assalamualaikum.
Welcome, Sam. How are
How
you?
I'm well, thank you. Just adjusting my camera a little bit.
Yeah,
Oh, Alia is saying salam.
welcome, Sam.
So I thought maybe we'd just give it like 1 minute or so for people to join and then we can start.
That's fine. Thank you.
How are you doing? Have you had a busy day?
Yeah, I tested positive for COVID over the weekend, but I've
Oh,
thankfully no symptoms. So
okay.
yeah, I'm proof that the vaccines do work. So yeah,
Yeah. Oh, that's good. I hope
yeah,
yeah, don't get any symptoms or anything.
yeah.
And hopefully you can then, yeah, test negative soon as well.
Yes,
Yeah.
yes.
So I think we've got a few people who've joined now, so I think we can start. Um, so first of all, hi everyone. Thank you so much for joining us. We're going live with Dr. Shamaila Anwar, and she has a PhD in epidemiology and a background in health research. And she's really interested in understanding health inequalities. In a moment, I'll ask Dr. Shamaila to introduce herself to us a bit more in a bit more detail. But today in this live, we're hoping to talk about scientific innovation in Islam. I think many people don't know about the way, um, a lot of the kind of groundwork for modern medicine has actually come from the Muslim world, from the past. So that will be really interesting for us to learn about. And I'm really excited actually to kind of sort of understand a bit more about that, because actually when we think about science, we think of it as a very kind of Western thing, kind of modern science is all about, has come from Europe essentially. And then also we're hoping to talk about COVID a little bit and our response to the pandemic, and then also vaccines and things as well. And hopefully we'll have some time for questions and answers. So feel free, if you're watching and you want to take part, put some questions in the comment box, or any comments or anything like that. But just to kick off, Dr. Shamaila, please tell us a little bit about yourself, about your background and things as well.
Thank you. Assalamu alaikum, everyone. And so really, really pleased to be here. I'm very privileged to be here. So thank you for having me. And my name is Shamaila. I am a British-born Pakistani Muslim. My parents came to the UK in the 60s and 70s to work and support their families. So yes, I live and work in West Yorkshire, so up north. I currently work for the National Institute for Health Research in my day job. But outside of my day job, I'm a science communicator. So I work with communities across the UK, really vulnerable communities, to help empower them to make informed decisions about their health. So it's understanding how we relay messages to them, particularly key health messages, and helping them to make the right decisions about their health.
Thank you. That's really interesting. And just, what made you become interested in, thinking about health inequalities and thinking about, trying to get out those health messages to, to grassroots communities up north or anywhere, basically?
Yeah, I suppose my kind of real kind of journey into this space started at the start of the pandemic, really. So we've known for many years, decades, centuries, that there's health inequalities exist in different communities. And I think it's the pandemic really kind of helped to bring that to light in a way that it's never done before. And I think that, coupled with the kind of, the Black Lives Matter movement and the racial kind of awakening of the world and the beginnings of it, we're not quite there yet, I think, really kind of helped to solidify this view that our experiences, our ethnicity, religion, our socioeconomic status, the information that we have access to, all impact on our lives, really. And I think for me, sort of in the small community that I live and work in, people know me. People know that I work for the National Institute for Health Research. So when at the start of the pandemic, the messaging going out was that research is the answer to the pandemic, and that everybody, particularly from Black, Asian and minority ethnic groups at the time, that was the terminology that was used, are disproportionately affected by COVID-19, and they should be coming forward for research. And you know, obviously then people were scratching their heads, you know, why is this not happening? Why are people from my community and from other different ethnic communities not taking part in research? And, you know, the answer for me and for many of my community was simple. You know, we don't have the trust there. You know, we have seen examples of the way that, you know, the research community has kind of abused our trust in the past. And we want, you know, obviously there's going to be some level of kind of resistance there until we fully understand what, you know, what the you know, the ask is of us, you know, to be involved in research. So I think that's kind of really where my journey in this started. And I feel very privileged that for me, the pandemic, you know, obviously had its negative impacts for my community, you know, stopping of worship, the kind of, you know, I'm sure you're very similar, Akeela, that, you know, my family lives close by. We're in and out of each other's houses every other minute, and all of that stopped. So there was the negative impact, but for me also was helping to find my voice a little bit and sort of seeing what I could do to help my community.
Yeah, and I really have seen you kind of use, you know, you spoke about using your voice, but I've seen how you've used social media to really kind of get out some of those things that you're passionate about and that you've mentioned. And for people who don't know, you are on TikTok. And later on, you can put in the comment section your TikTok handle. But you've got a kind of sizable following on TikTok, and I think it's really cool what you've done with TikTok. But just picking up on some of the things you've mentioned there, you spoke about you know, Black and Asian communities being disproportionately affected by COVID. Now, there's lots of different theories about why that is, but I mean, could you tell us, you know, why are Black and Asian communities disproportionately affected? And I think in particular, you know, as well as the Black communities, you know, Pakistani and Bengali communities have been disproportionately affected by COVID. So, you know, and there's different theories about that. So, yeah, could you tell us what do you think is the reasons or are the reasons for why these communities have been disproportionately impacted?
Yeah, I think decades and decades of discrimination. I think certainly marginalisation. Coming from that community, you know, I'm not saying this in a blasé way. You know, I've seen the impacts that, you know, having disparities both in our education system, in our opportunities in the workplace, in the way that we are perceived by other parts, you know, other parts of society, all have an impact on us. And I think when we describe health inequalities, it means different things to different people, and it can mean a wide range of things. It can be everything from kind of death rates in communities or mortality rates, right through to sort of kind of the quality of the housing and the socioeconomic status. So it depends on exactly what you're thinking about when you're talking about health inequalities. But certainly a lot of research, and there's research coming out every other day in this space that, you know, around the different kind of reasons and factors why health inequalities exist. But certainly in terms of the pandemic, we knew that, you know, Black and Asian minority ethnic groups were disproportionately affected. People that were disabled, the elderly were affected, and particularly socioeconomic deprivation. So areas of high socioeconomic deprivation, you were almost double the likelihood of having a worse outcome from COVID-19 than you were from the lowest level of, you know, deprivation. So there are different aspects to this.
Yeah, no, and that's really helpful. And I think so I didn't introduce myself. I realized at the beginning I should have probably said to people that my name is Akeela Ahmed and I'm the founder of She Speaks We Hear, and I can talk a little bit more about She Speaks at the end. We have a whole team of volunteers who work hard to basically amplify the voices of Muslim women, but then connect them to the public sphere and, you know, a wider society. And so having people like yourself is really key to our work, because not only are you an expert in your field and a role model, you know, and you've achieved so much, mashallah, but also you're using your voice in a really powerful way to help empower communities. And that's something that's really important, essential to our ethos at She Speaks We Hear. But outside of She Speaks We Hear, I sit on a governing body for an NHS clinical commissioning group in Brighton and Hove. So I'm sort of familiar with health inequalities. But one question I do get asked is, okay, so when you talk about the drivers of health inequalities, you're talking about things like socioeconomic status. you know, being in a kind of low income job or not having qualifications, but how does that then impact on your health? And how does that then, you know, why does that mean then, you know, you suffer from COVID worse than somebody who doesn't live in that kind of situation, who maybe have a more affluent job, or you know, things like that, who lives in a better area? I mean, it's still London. So how would you respond to those sorts of questions?
I think that
Just to
when we talk about health,
explain.
yeah, sorry, go on. Sorry, you cut
Sorry,
out
I was
there.
just going to say, just to explain. Oh, sorry. I think my, is that okay now?
Yeah.
Okay, cool. Yeah, sorry. Just to explain to people who might not understand how health inequalities relate to those other social determinants.
Yeah, so I think health inequalities, I mean, just to start back from the beginning, are avoidable, unfair, systematic differences in the health between different groups of people. And there's many kinds of health inequalities and many ways in which that term's used. This means when we talk about kind of health inequalities, it's just so to be clear on what measure we're using. So that could include health status, for example, your life expectancy. It could mean access to care. It could mean quality and experience of care. It could mean behavioural risks. It could mean wider determinants of health, such as quality of housing, like I said before. And then when we're talking about different factors, for example, are we looking at kind of, the different kind of postcodes of people? Or are we looking at socioeconomic factors, i.e. your income and your access, in your ability to buy? It's really difficult at times to be able to sort of separate everything out. But I suppose this is the kind of, yeah. Sorry, am I cutting out?
Sorry, somebody's saying no sound.
Oh.
Yeah, someone has written that there's no sound, but I can hear you.
Yeah, I can hear
I don't know.
you.
Can people, you can hear me, can't you?
Yeah.
Yeah, okay. Is that better now? Can people hear us? No one's saying anything, so sorry to interrupt your flow there, but
It's
yeah,
all right. No, so it's the interplay
okay.
between all these.
Out. Okay.
Great. It's the interplay between all of these factors really that we're considering. So if you are coming from an inner city deprived area, what is your kind of the status of your income? Are you what income bracket are you in? Does that is the quality of the kind of air around you, and all of these things have an impact on us. So that's the kind of way. It's a very difficult, notoriously difficult kind of research area to be in, because of all of these confounding factors.
Yeah,
it helps to explain a little bit about the kind of relationships.
Yeah, no, thank you. That's really helpful, and I think hopefully that helps people listening as well, to understand a bit why we talk about COVID and then health inequalities, but then we also talk about the types of jobs that people are doing, or maybe where they live, because all of that actually impacts on our health, and maybe we don't necessarily realize it. You spoke about earlier, you spoke about people not wanting, or people basically not having trust in the government and establishment. I mean, you mentioned a little bit about potentially where that comes from, but what can be done to try and address some of that, lack of trust?
Yeah, I think there's a number of things. Certainly, from the perspective of kind of research, because this is where everything starts in terms of kind of healthcare and medicine. Any medicine that you have access to now, for everything from your paracetamol to your Calpol for your kids, right through to kind of the complex chemotherapy that people undergo, when they have cancer, has all gotten there through research. And so it's kind of important to sort of know that even things that you think haven't been you take for granted because you can buy it over the counter, all of these medications have gone through research and are still continuously monitored in terms of the kind of impact on your health. But yeah, in terms of kind of the gaining of trust, I think there's a number of things. I think we need to start understanding that we've got to work with communities and understand what the challenges are for them, not just about us going in sane. We know what the challenges are. As healthcare professionals, I think it's really important that we have that open dialogue, and that we link in with people both within our organisation that may be able to help those kind of relationships develop, but also try and identify people from the community to help us to be able to do that. And that is, and I think that going in with the expectation that this trust is going to be gained just like that is a complete fallacy. You know, you've got to understand this is decades, centuries of kind of inequality and mistrust, and all of the kind of history that goes with it. And that isn't going to be something that people are going to go up, you know, give up overnight. And I think that as healthcare professionals, we are worried sometimes about going in and saying, do you know what, we don't know how to do this, we don't know how to engage. But actually, if you do that and you say to communities, you need to help us, you'd be quite surprised that the balance of power then shifts, and they're actually more willing to come to the table and to listen and to understand where we as healthcare professionals are coming from, but also then being open to having the health messaging and kind of being able to sort of help themselves. Really, I think it's very much about empowerment, how we empower people, and it's about psychological safety as well. There's a lot of mistrust, particularly within the research arena, from the kind of malpractices of the past. And to be able to sort of gain that trust from communities, you have to be very transparent and open and be willing to listen. I think that's the key to, your ears basically are the key to gaining people's trust, I think. Yeah.
And not to make assumptions, I think, as well, because I found, you know, sometimes when I've gone to, not so much recently, but in the past, you know, I've gone to the doctor's surgery, and, you know, the receptionist's first question would be, you know, do you need an interpreter?
Yes.
And I sort of think to myself, well, I have not even opened my mouth yet.
Yeah.
At least let me speak before you make an assumption about me, you know, based on, you know, how I look, basically.
Yeah, absolutely.
And even though that's just a receptionist, there is I mean, you spoke about power imbalance, but there is a power imbalance there, isn't it? We're quite vulnerable, aren't we, when we're going to a health professional, whether it's a doctor or a dentist or whatever it is, you know, because we're putting our health and care into their hands, and so often we're deferring to them because they're the expert. How do you think that has played out then in terms of COVID-19 and then the vaccine? And actually, I don't know if I should hold that question, because I am really interested in your knowledge of, you know, the history of science and Islam as well, and I do really want to come to that, but maybe just answer this question first and then we can talk about history of science and Islam.
Yeah, I think the trust with the kind of vaccines is played out with, you know, we have this perception that certain communities of colour, particularly, I think that if they are kind of hesitant, I mean, first and foremost, being hesitant about anything you put in your body is entirely normal. Let me put that out there and then. There's no judgment on that. Even I would be thinking about what I would put in my body every day, from everything that we eat to drink to actual medication. So, you know, there's no judgment on that score. But I think in terms of the COVID-19 pandemic, you know, when you've got a public health emergency like that, people are often judged when they don't do their bit. And, you know, we were called on to do our bit, and part of doing our bit was getting vaccinated. And I think people often kind of judged people for not getting vaccinated because of that. So there's an element of, again, the assumptions point of view, that, you know, people assuming that just because you're hesitant means that you are against science, or you're into sort of the conspiracy theories, etc. But actually, let's look at the evidence. You've got a situation here where you know, we're in a public health emergency. We're developing vaccines. Yes, the vaccines have been very efficiently developed, and I'm specifically being careful about the terminology I use here. We are working from the some of the information we already know about the vaccines and the technology used and the virus itself. So we're not starting from scratch. But essentially, you know, we know that there are certain communities that are hesitant. And that hesitation isn't because we are against science. That hesitation is because of a lack of trust. So actually, once you start building those bridges, we saw the kind of, you know, the vaccine uptake rates go up. And so, you know, and then we obviously saw as well that the kind of misinformation and the undermining of that as well. And a lot of that is kind of, you know, people in the era of social media, it is so easy to knock something up online that looks valid, that looks accurate, that looks, you know, looks kind of, you know, official, that it's very difficult for people, I think, to kind of understand actually this is something that isn't valid, isn't official. I shouldn't be taking this at face value. I need to be speaking to somebody that has got the knowledge and experience and you know, is going to give me accurate information. So again, there's that double whammy of trust, I think, you know, developing that trust, but then also how do you know who to trust as well, you know, and that's, we've never really seen that before in any of the other pandemics previously, because social media hasn't really played a big part as much as it has this time around.
Yeah, that's absolutely true, I think, because I mean, even just when I've been trying to tweet about this event, our live, and I put hashtag vaccine on Twitter or something, and the first hashtags that come up are basically sort of against the vaccine.
Yeah.
But I think that you know, this lack of trusting is so, yeah, is really key, definitely, because I've heard this from other people as well. And you're right, it's natural to kind of want to know more information about what we're putting into our bodies, what impact it will have. I mean, I've got 2 teenage daughters and they're vaccinated, but you know, before they took the vaccine, I did think to myself, okay, I need to kind of look at this before they go and get the vaccine, because I didn't want there to be any kind of like impact on them in the future or something like that. And then I went away and I had a look you know, at some of the research, and you know, I spoke to medical professionals, and that really helped. So there's a couple of questions about this. Maybe I'll just go through those before we kind of move forward. So Hamera's asking, is there bias in research, and how can researchers prevent this to help communities? And then Shameen has commented, I do think people who haven't had the vaccine yet are unpersuadable. So maybe, you know, what do you think about what Shameen has said? And then maybe you can answer Hamera's question.
Yeah, so I think absolutely right. There is going to be a certain contingent of the population that we're not going to be able to persuade, and I think that we live in a country, you know, a community where you have the medical choice, and as a health professional, as a you know, a research professional, it's really important that I respect that, and you know, I'm not going to judge anybody for doing that. So I think that kind of answers that question. And sorry, what was the other question? Was it about bias?
Yeah, so Hamera's asked about if there's bias in research, and how can researchers prevent this to help communities?
Okay, and do you mean bias in terms of bias against a specific ethnic group, or bias as in the results being biased?
Maybe Hamera can explain that, and then can, Hamera, if you could just clarify your question, and then I can just put forward Alia's question. So Alia's asked a good question. She's asked, are people that haven't had the vaccine yet benefiting from herd immunity, which has been created basically by everyone else having the vaccine? Because I think the numbers are quite high, aren't they? I think in terms of the population, 70% of the UK has had 2 jabs, haven't they?
Yeah, so I think
like
I can't really answer the question about the herd immunity, but what I can say is that we know that obviously majority of the population has been kind of double and triple vaccinated, so that's one thing. A lot of the population has also had some, you know, one or other form of the COVID infection, so we know that there's some level of immunity there as well. I think that certainly the kind of most recent Omicron and the Omicron variant, we know that it's more transmissible, but we know also that it's not as severe and dangerous. So that indicates to us either, you know, that the actual virus is changing and obviously adapting, but also, you know, we as a population are able to deal with it a bit more.
That's really helpful. So Hamera's come back and she has said both, and she's also said, but mainly bias against ethnic communities.
I think that so I kind of want to sort of dial this back a little bit. So I work for the NHR, and one of the challenges that we've always had, and we've known this, has been that we're unable to recruit people from different communities. Now, I said unable to recruit. But actually, and there's been a lot of work done around this about how we term these people. Are they hard to reach? Are they underserved? Are they seldom heard? Or are they underrepresented? And at the end of the day, I think that it's always been put onto the hard to do pile because we never know, we don't know how to do that.
Yeah.
I think that the pandemic has shone a massive stonking great light on it, and it needs to change, because how can we then assure that the medicine that we produce, the vaccines or the other medical treatments that we produce are going to be of benefit for everybody? We don't know that. So the kind of the pressure's on now for us as the whole research community to be able to address this. So I think that whereas before there might have been this view, or that somebody from the Asian community is going to be really difficult to recruit to a trial, that isn't an acceptable excuse anymore. We need to engage with these with communities like my own, and there are a number of ways, a number of initiatives that are happening that are helping us to do that. Understanding what the barriers are first and foremost to our communities taking part in research. I think that there's been a lot of work done about how we term these groups, whether we say underserved or underrepresented. And I think that, my view is that we waste a lot of time in the terminology, but why do we need to bunch everybody together? Surely that defeats the object. We are all different. I would say that I'm not even representative of my own community, let alone the British Pakistani community of the UK. We all are. Inclusivity by its very nature is highly intersectional. So we are people of many parts. I'm British Pakistani Muslim. I'm a woman. I work for the NHR. I live in West Yorkshire. I have asthma. I have a history of allergy problems. Not everybody's going to be the same as me, and every experience is not going to be the same as mine. So I think we need to get away from the terminology, but there is an understanding that that people from different communities have been much more difficult to recruit to research, and therefore we've not tried. But that is now changing within the research community, and there are some really, really fantastic examples of the way that researchers are trying to reach out to communities now.
That's really interesting. And actually, yesterday I was just in a meeting with policymakers, and and I basically said to them that actually, communities, grassroots communities, you just need to get out there and speak to them.
Yeah.
Because not only will they be able to tell you about the barriers that they face, they'll also be able to tell you about the solutions to those barriers. And then I was reflecting about how actually I think as grassroots communities we have a lot of power, but sometimes we don't recognize it.
Yeah.
But also, it's very complicated. I completely understand that. But no, that's a really, really interesting answer. So just kind of moving on a little bit now, I'm really interested in this whole piece about scientific innovation in Islam and the kind of the history of science in Islam. So how did you become interested in that in the first place?
Yeah, so I think for me it was my the younger generation of my family actually. So I was very privileged that my mum came to England. She's from a very poor family, but came to England being able to speak English because her dad was a soldier in the British Indian Army, and when he died in action, she was she was allowed to apply for scholarships to go to school. So there was 8 of them. And so when she came here, with my, to marry my dad, basically, my dad had been here 10 years earlier. He was 15 when he came, and he came to work for his, to support his family. So they're both very young. And I suppose, a big characteristic of kind of communities that move from one area of the world to another area is to sort of hold on to their traditions and their, very much more strongly than their kind of brothers and sisters and families back home. So being taught how to speak and read Urdu was a big part of my childhood. And, a lot of the Urdu books that we read talked a lot about the kind of innovations and the science and the golden age of Islam and all this. So that's kind of where the roots of my kind of interest lay. And my first degree was actually in archaeological sciences, would you believe, as well. So I was going to be an intrepid archaeologist in a former life, but then I chose this path. So yeah, that's kind of where it started. But for me, it was a stark realization that the younger generation of British Pakistani Muslims, or Muslims in general, had no real idea of kind of the contributions that our forebears have made to science. And actually, you know, and that's because of the education system. Essentially, when we go to school from a very young age, we are taught kind of very much the kind of Eurocentric view of the world and the history through, you know, the history of Europe, whether that's kind of the kings and queens of Europe, World War I, World War II, you know, and all of this kind of science. It's Einstein, it's kind of Edward Jenner, you know, and all of these people, but actually nothing about kind of people, any kind of reference to people of colour and what the contributions they've made. So a lot of the kind of pandemic response that we see, things like quarantining, the methods that we use to overcome a pandemic, quarantining, vaccination, all stem from kind of, you know, Muslim kind of research and Muslim teachings in some way. And, you know, some of these actually go back even further to the Greeks. But actually, the key point is that our forefathers were very adept at kind of understanding what had happened before, understanding the research that had happened and the theology that had happened before, and actually building on it. So they kind of utilised that and were very efficient in that. And actually, you know, whereas before, there's and the jury's still out. You know, so there's some people that still would kind of contend that, you know, Islam isn't as kind of, you know, the contributions that we see, you know, aren't as great as kind of all that, because they kind of built on what the Greeks did, etc. However, that is the kind of pure nature of science. You learn from the past and then you build on it. So yeah,
each civilization comes along and then adds
yes,
more to what's already been learned in the foundations. But what I found really interesting when we spoke before, you know, before this live, was that I think you had mentioned something. I think, was it smallpox or the plague, something like that, about how they had. Would you like to tell us a bit more about that example, because that was really interesting, and it actually had so many examples.
Yeah, no, I think smallpox is a classic example. So, you know, throughout kind of the you know, the centuries, smallpox has kind of, I mean, it's completely eradicated now. It's considered eradicated. The cases are so low, you know, if they do come up and they've got, you know, an effective strategy to deal with it. But actually, there were many centuries where smallpox epidemics and pandemics would shoot up, particularly within the Muslim world. And we know of the kind of, you know, the practices, you know, the precursors to vaccination, which was called variolation. Actually, there are some contention as to whether it was kind of the Chinese that kind of developed that, or whether it was Muslims. But what has become clear is that there were different variations of it. So where the Chinese would actually blow the kind of dust from the pustules that smallpox produce up people's noses, and in the hope to induce a milder form of the virus and the infection. Within the Muslim world, it was actually scratching the kind of the pus from somebody that was infected into the arm of an uninfected person to give them a milder form of the disease. So these kind of these kind of measures that we used for diseases like smallpox were actually, you know, the Europeans were kind of very, very aware of them and took them back to Europe and actually it was a while before these kind of these things were, the vaccination processes were taken up within Europe. There was a lot of resistance to it because obviously these were from uneducated, uncivilized tribal communities that got no idea about health and hygiene, and yet, you know, it is Muslim scholars that understood that disease can be spread through microscopic organisms that we can't see with the naked eye, so through water, through touch, etc., which was something that, you know, came much later in kind of Europe.
Yeah, no, that's so interesting. And I think was it Avicenna or Ibicena who came up with the 40 days, or is attributed with the 40 days kind of quarantine, so that this idea of quarantining sort of came from him or those kind of scholars at his time.
Yes, absolutely. So we've got, like, you know, pandemics like the plague that lasted for centuries and centuries and centuries because we knew very little about the spread of disease and how to control it. And then slowly, once we started to understand that actually this is a disease where people need to isolate, and it's actually through contact that you get that disease. And so being able to sort of put isolation processes in place meant that slowly we managed to get on top of that. And then we started understanding about kind of vaccination through diseases like smallpox, and then the use of face masks, particularly with the Spanish flu in the 19 just after the First World War, in the in the teens and the 1920s. So yeah, we learn different things from the different pandemics. But what I'm trying, I suppose what I'm trying to get is a lot of these ways that we deal with pandemics stem from the kind of research and the teachings of Muslim scholars, because for us, Islam was the first religion really within the Middle Ages to not view disease as a punishment from God. All the other religions, Christianity, all of them, believed that if you were diseased, that was a punishment for a sin that you'd committed, basically. Whereas in Islam, it was very much, no, this is something that we need to overcome through the acquisition of knowledge. And our own prophet, completely kind of conveyed that message and said, if you don't understand something, ask the people that do understand. And particularly about quarantining when infectious diseases erupted. We know that our prophet Muhammad, peace be upon him, was very much a kind of in favor of instigating quarantine and understanding how to treat diseases.
That's so fascinating, and I actually hadn't thought about it in that way. I hadn't actually thought about the difference in the way the religions at those times were talking about disease in a different way. That's so fascinating. So why does, I guess you've kind of answered this a little bit, but you mentioned, you went more into learning about the history of science in Islam because of your nieces and your nephews. But why does it matter? Like, why should we, we're in this modern world now. Why does it matter knowing about science in Islam?
I think for me, coming from a community that was disproportionately affected, and coming from a community that is considered to be marginalised, I think there's two aspects to this. The first aspect is that there are assumptions made about our communities. As Islam being a very rigid religion, it turns its back on, turns its face away from science and modernity, when actually in reality it's not. If we look at the way that we teach our young about our religion, I know from my nephew, he's just turned, he's just 6, he's going to be 7 in a few months' time. And I can remember, teaching him our prayers and namaz and things like that from literally from the moment he was able to sit up, really, and be able to say his first words, and we kind of people have this view of our religion as being extremely rigid. And I suppose first and foremost, it's about kind of understanding, and breaking down those assumptions about our religion. For me, my religion, Islam, is probably one of the most flexible religions you could have, really, and one of the most child-friendly. We think about our children. We pray, and we've got them around us so that they're completely comfortable with and grow up with the habit of being able to pray and things like that, and they can come in front of us and they clamber over us when we do go to sujood and all this. And I don't think there's many religions that would tolerate that, and yet we do. So it's kind of seeing the softer side of our religion, but also that this can only be done, this kind of counteraction of the assumptions that people have of our religion can only be done if we give our young people the knowledge that they need to be able to counteract these kind of assumptions. And that is understanding that our religion was at the forefront of science in its heyday, and it will get there again. It's just through the passage of time that certain sections of our religion have kind of turned their back, but that does not mean that the majority of us have turned our back and don't understand the importance of family, of community, of doing our bit.
Yeah, that's amazing. And you mentioned prayer there, and that just made me think about so basically my one of my teenage daughters is really into yoga, and she's noticed how some of the and I'm not an expert in yoga, so I'm probably going to make some mistakes when I talk about this, but she's noticed how some of the movements in yoga are really similar to doing namaz, and I just find that so fascinating.
Absolutely.
And similarly, just this idea of quarantining actually is quite a strong culture, it's throughout our kind of culture, I find anyway. My parents are from India, but you know, after you give birth, I remember my mom was telling me, you know, you have to rest for 40 days. You know, if somebody passes away, then you know you're supposed to mourn for 40 days. We've got this quite kind of strong sort of
Yeah.
theme of, you know, I mean, it's not quarantining as such, but I can see how it relates to, you know, if there was disease and somebody's passed away from disease, then everybody around that person should kind of stay in mourning for 40 days. But it has other, you know, benefits and relates to, yeah, to the Quran
Yeah.
and faith, things like that. And that's so powerful, I think, that relation, understanding our history and that relationship between science and Islam. You mentioned about how that can really help us, you know, understand basically kind of who we are and where we come from, I guess. But how can that then also, like, how does it relate to the pandemic? Like, how can that help us protect ourselves? You know, if we're more vulnerable to health inequalities and, you know, and COVID-19, how can this kind of understanding or and things like that it help us protect ourselves from, you know, the negative impacts of, you know, the pandemic?
I think for me, simple. It's empowerment through education. Knowing what knowing what the kind of key challenges are in any given health issue, knowing what your rights are, knowing what you can do and should do and what you can't do, and what you shouldn't do, I think is absolutely integral to this. And I think that it's a real challenge, particularly you know, if I think about my own community here, sort of, you know, at the height of lockdown, at the height of the pandemic, you know, all the places of worship closed, your doors closed, you weren't allowed to go to see your family, you weren't allowed to mix. So the very essence and the very kind of fabric of our community was kind of completely, we were in complete disarray. We didn't know what to do with that. And, you know, we've seen kind of the different kind of messaging going out, you know. So for example, for Muslims in the UK, it was like, we should be mixing, we've got to adhere to these guidance. And yet people in Pakistan, our own, you know, brothers and sisters in Pakistan, were not under that same regime. So I think this is where the challenge is, when we've got kind of, you know, public health measures that need to be taken, and we've got kind of a strong religion that relies on us interacting and, you know, having communal worship and coming together. And how do we try and kind of explain that? And I think this is where, looking back in history and understanding that why we have to do certain things, i.e. why we have to quarantine, why it's important that we wash our hands and we maintain hygiene, and why we've got to sort of, you know, not have our doors open to kind of anybody coming in, you know, at those particular times, is really, really crucial. And I think that, you know, I mean, certainly I've not had a pandemic like this in my lifetime. So I would never have known at the start of it, this is what needs to happen. And I suppose many people, you know, were in the same position as me. So kind of looking back through history and trying to get that kind of, you know, okay, this is what normally happens, I think is a key part of that.
Yeah, that's really helpful, actually. And it helped me just, you know, speaking to you, to kind of, before this live, to think about, actually, wow, you know, there's so much knowledge that exists within our own kind of heritage, you know, in terms of our faith, but we don't necessarily know about it. And one of the other examples, if you could share, that you mentioned to me, was about and it's not related to the pandemic, but it was about C-section, and how actually that kind of didn't originate in Europe either.
Yeah, absolutely. So yeah, it was a Nigerian method, basically, and which, you know, I think because it was termed cesarean, people think that it was a Roman, you know, Caesar, you know, was born by C-section, and that's where the term and the actual method originated. But it's not. It's actually much older than that, and it was, you know, it was in Nigeria, and it was actually the kind of white settlers in Nigeria that kind of found that, whereas women were dying predominantly, you know, in childbirth, you know, if they had complications in childbirth in Europe, you know, in their own communities, Nigerian women, you know, if there were complications, both the kind of baby and the mum were more often than not saved. So, you know, what is it that they're doing, and being able to sort of understand the technique that they use, and actually and actually be able to sort of practice that technique was kind of, you know, it's amazing really that, you know, we're going from you know, thinking that cesarean section, you know, you've got all the anesthetics and everything, to actually, you know, quite a, you know, a situation where you've got kind of African tribes practicing this, you know, and actually, you know, developing this technique, and then it's taken and being used in Europe, and actually we completely forget where the origins of this is, and I suppose a lot of that, and there's a lot of contention around this, what I'm going to say is kind of, you know, that was kind of very reminiscent of the colonial era. I mean, that's one of the reasons why, you know, colonialism and imperialism was able to develop so quickly, was kind of, you know, the way that the Europeans came to different areas like Africa, like India, were able to take all of these kind of, you know, these kind of inventions and discoveries and make them their own, and we almost have forgotten where they actually originated from.
Yeah, we've totally forgotten. And Shameen has said that it's such a shame our religion has been hijacked and our history has been forgotten, just what you were saying, and is being erased. And I think, yeah, I mean, there's lots of debates about, you know, colonization. It's very now
Yeah,
about it.
it's very now, and there's a lot of emotion attached to that. So there'll be some people that say that, you know, you know, the Renaissance in Europe, sort of around about the 15th century. Perhaps some debate that it started earlier, but that was the start of it basically. And before then there was no science and no culture, but actually there probably was. It just wasn't as well defined as it was in the Muslim in the Muslim world. And, you know, as the Islam and the Muslim world started to decline, and the kind of golden age started to decline, the Renaissance period continued, and, you know, the way that was taken forward, that, you know, everything was aligned at that point for science and culture and religion to sort of have a rejuvenation in Europe, which has then made people forget that actually a lot of these discoveries were pre Europe coming of age. Europe was quite late to the table when it came to science and scientific discovery, and, you know, there has been kind of examples of kind of people now realizing and acknowledging Muslim scholars for their contributions.
Yeah, and you know, that's not to take away from the progress that Europe has made, or, you know, modern science and things like that. But I think,
Yes,
you know, you're absolutely right. It's fascinating to learn about the contributions from different civilizations. And I heard yesterday that the word algebra actually comes from the name of a Muslim. I think it was a Muslim scholar, or definitely an Arab
yeah,
anyway.
yeah,
And yeah, and that, you know, that's just fascinating. I
yeah.
just want to ask people, if they want to put any questions, please put some questions in the comment box, for Shamaila, about anything really related to this topic. But yeah, so as I was saying, you know, algebra, maths, that's all come from Arab Muslim.
Algebra, algorithm, alkali, you know, all of these, you know, epitomize what science does really. Without algorithms, wouldn't have computers. Without algebra, we wouldn't have modern maths. And, you know, our numeral system, you know, we would have been reliant very much on the inefficient Roman numeral system
Yeah,
before. And then, you know, as well as alkali, you know, very much the essence of chemistry. So even the language and the terminology we have, you know, has kind of very Muslim, very Arabic roots.
yeah. She means saying you have to go to Andalusia to find out how enlightened Muslims were.
Yeah,
And it is nice, I think, to go there as well,
yeah.
apart from just learning about the history. But no, absolutely. So, Shemaya, you know, thank you so much. We're coming towards the end of our time, and I thought before we finish, and while people might want to put any comments or questions in, we always kind of like to end on a kind of positive note. And so I've got a couple of positive questions to ask you. So, you know, I wanted to ask you, what are you most proud of out of your achievements? Because mashallah, you have got, you know, many achievements, and you're doing, you know, really well, mashallah. So you're making such an important contribution
Oh, thank
by
you.
in this way.
Yeah. So my kind of the one that I'm most proud of is a very simple one. I'm proud of my relationship that I'm developing with my nephew. I think, you know, I think it's really important. You know, we can go on about, you know, all of the qualifications and everything, but for me, having that relationship, that open relationship with my nephew or with my younger generation of my family is really, really important, because it's through that kind of knowledge and that transfer of knowledge that you get that kind of consistent kind of, messaging about your culture and about your religion, and that being able to sort of change hearts and minds about it. I think that's really, really important. And I come from a generation where, you had your grandparents and your aunts and uncles, but it was a very formal relationship, and I want something very different from me and my nieces and nephews, where they can come and ask me anything, So that's probably what I'm most proud of, I'd say.
That's amazing. And I think you're being very humble as well, because it's not easy to communicate about science, but you do it so beautifully.
Oh, thank you.
Make it so accessible, as well as having your qualifications in scientific research as well. I think that's amazing to be able to communicate. I did a STEM degree, and I met a lot of academics who couldn't communicate, unfortunately. So you're being very humble. And my sort of last question is, who inspires you?
My parents, I'd say. My mum and dad. I mean, my dad came here at 15, and what do you know at 15? And came here to work for his 10 brothers, and one sister. So he never got the opportunities that I've got and my brother and sister have got. So I think that's my inspiration. And my mum, she came when she was 17, and within a year she got married and had me, and no parents here, no mum here to tell her what to do. She was completely on her own. I mean, that would be completely unfathomable in this day and age. And you take every opportunity. I want to say to the young people, you take every opportunity that's offered to you, make your mark, and do the best that you can, and you'll get there.
That's such a nice and positive message. Your mum and both your parents, your dad as well, sound amazing, mashallah, and they must be so proud of you. Dr. Shamaila, I've just noticed a question. I'm sorry, I didn't realise there was a question waiting. So just quickly, the question is from Shameen. My kids had COVID in December after having their first vaccinations in October. They got it very mild. I don't think they need the second dose. What do you think? Her children are 13 and 15.
And when are they due for their second dose? Is it going to be sort of in a few months' time? I think that we know that vaccines, once they have been administered, at least I think for the first dose, they've got at least 6 to 7 months before immunity starts waning. I understand that you think that because you've got some level of natural immunity there, that's gonna help as well, and it will. But actually, we know that natural immunity is much more kind of volatile than kind of vaccine-related immunity, because vaccine-related immunity is very, very targeted. Your natural immunity kind of induces a response that is very widespread. So I'd kind of bear that in mind. Bear in mind that you might think that they are kind of, they're kind of boosted, and at the end of the day, it's your choice. But I would say that, if you, in a few months' time, get the calling to get kind of a second booster, I would go ahead and do so, and particularly speak with your doctor first if you've got any concerns about that.
Thank you. That's really helpful. I think speaking to professionals if you've got any doubts as well is really helpful. That helped me as well. But really helpful to know about how the different types of immunity interact with our existing bodies or our existing systems, because there's a lot of misinformation out there, as you said.
Yeah.
And so there's a lot of misinformation as well about the immunity that you get through vaccines and things like that. But no, thank you. That's been so helpful, and it's been so wonderful to speak to you.
It's been a privilege. Thank you.
Please tell us your TikTok handles so that we can go and check out your TikToks. I have actually seen them.
Yeah, it's Dr. Shamaila.
Sorry, say that again.
At Dr. Shamaila.
Okay, cool. Yeah. And I'll put that in the comments section underneath the live, so once it loads up to our feed, inshallah. But thank you so much. It was really, really interesting session. Really good to hear from you, and on such a broad range of topics as well.
Thank you. Thank you so much. Thank you everyone for listening.
Not at all. Take care. Have a good evening now.
Okay,
bye. And bye everyone. so much for
Bye.
joining.
Thank you.
Bye.